So for the Great Look team, there is like still some issue. Maybe you can fix that.
Yeah, try now.
Right. All right. And here we go again.
Yeah.
Okay, so that was a long way of saying that dermatology is definitely a very exciting field in which exosomes have their application. And you see here, when we talk about aging and environmental factors that actually damage our skin, for example, and lead to limitations and impairment of various biological functions, then exosomes are a promising means to remedy the situation. The way exosomes work, well, they are cellular messengers. They are experts in cell-to-cell communications, and they are secreted by virtually all cells in the human body. And then they can be taken up by target cells, that are cells that are either damaged under duress or senescent. And they can take up those exosomes. That works by fusing with the cell membrane, and then exosomes have the ability to introduce all their cargo into the target cells. The cargo consists of growth factors, cytokines, chemokines, and loads of other functional proteins, lipids, metabolites, various enzymes, and a whole range of RNAs. So I always describe it as providing the cell with all the building blocks and the instructions to actually reprogram and return to a more youthful state and a fully functional state of that cell. So not surprisingly, exosomes therefore have a very, very promising range of applications in the field of dermatology. So why? If you could please all mute yourself when you talk in the background, I would appreciate that. So why human umbilical cord or Shelley derived exosomes? Here is just a list. You might have seen that presented a couple of times that just compares a few prominent sources. The column is showing Wharton Shelley MSCs and exosomes derived from it, and various relevant factors that are exhibited there in comparison with adipose tissue, bone marrow tissue, bone-derived MSCs that have much more limited panel for interesting factors. That is the reason why we resort to Wharton Shelley mesenchymal stem cells to derive our exosomes. We also call them H0 exosomes because by the sheer nature of them, they are the youngest adult stem cells that you can get your hands on. And if you talk about rejuvenation and also regeneration, these are the stem cells that you want to use to derive your exosomes. H0 is to one part a reference to the age of them. So they are the freshest and youngest stem cells and subsequently exosomes that you can find. But it also goes beyond that. H0 is also designation for something that is a remarkable feature that while we are undergoing development in utero, we have the capacity for total regeneration and repair. Which means if the process of development, something goes wrong, it can be fixed and completely repaired. One of my favorite experiments is where they inflicted a cardiac infarction on rat embryos in utero. And so in the wake of that, a lot of tissue gets damaged and destroyed and replaced by collagen, overshooting collagen. So it's scar tissue, and scar tissue is non-functional tissue, but at least the organ stays the integrity of the organ is preserved. However, when that happened to us as an adult, this scar tissue really impairs the function of the heart. If it happens to you pre-birth in utero, then even the scar tissue gets fixed and replaced by functional tissue. And that is done by the sheer virtue of those stem cells that help to not only develop the body and its organs, but also to regenerate and repair if something goes wrong. Unfortunately, we lose that capacity for total regeneration and repair as soon as we are born. Obviously, we still have regeneration potential, but then again, with age, this is further limited and decreases in efficiency. And this is where our exosomes come in handy, because they have the designation of H0 and the ability, the capacity for total regeneration and repair, because they are derived from mesenchymal stem cells that were created before the baby was born. And that makes them so special and unsurpassed when you compare them to many other MSCs or exosomes derived from various other sources, sometimes dubious ones added. So how do exosomes work in the field of dermatology? You can apply exosomes in various ways, and with it, you trigger things like angiogenesis, so that tissue can be better provided with, blood flow and therefore oxygen, everything, and nutritions, everything that is important for various tissues. You increase collagen synthesis, and you also regulate inflammation, which is one of the key aspects of what exosomes address. And its inflammation is always, a somewhat underlying cause for any kind of disease or impaired function of various tissues. To give you a few examples, one of my favorite examples are these two gentlemen here. We call them patients 0 for hair restoration protocols, something we tried early on. It was a combination of microneedling and the application of exosomes after. This gentleman here to the left, he is in his mid-40s, or was in his mid-40s. Notice some thinning hair on the top panel. After just one application of microneedling plus exosomes, about 4 weeks later, you will appreciate that the hair seems to be visibly denser. And also, interestingly, it seems to be overall darker. So the top photograph you see, it's a lot of gray hairs and dispersed, and where it regrew into a denser effect, it seems to be overall darker. So that is a clear indication for rejuvenation, that we actually can go back in time. And you see that confirmed on the right panel. That is a gentleman in his mid-70s, and he has a sizable bald spot. And he said for about 3 decades, he can hardly remember when it was not there. And he underwent some treatments of also microneedling and exosomes. And initially, he was somewhat underwhelmed. He noticed some baby hair on the bald spot, but was hoping for a little bit more. But after 2 treatments, you see the bottom panel here, you do see that it is obviously much denser, but also what became apparent is that the size of the bald spot decreased significantly. Again, there's implying a rejuvenation taking place, because the way a bald spot develops is that you have thinning hair, then you have a small bald spot, and then the bald spot grows in size. And it seems that applying exosomes will actually return that to in time, like where the bald spot starts to like grow smaller and eventually might even go away altogether. So it was interesting to see, and very compelling, that you really seem to go back in time. So rejuvenation is not just a buzzword that we are using, but with each application, you seem to be able to shave off some time of the biological clock. Other applications are scar prevention or scar reversal even. You see here a half scar study that was done after a C-section. On the left side, it was left as is, and the right side of that scar was treated with exosomes, I think daily for some time. And you will appreciate that the healing of the scar is much better, and you really see only this fine line as opposed to like this purplish and still partly open scar on the left side. Then we have a patient, a case study with a decades-old scar that was also treated by microneedling plus exosomes, and you do appreciate the visible improvement in the appearance of that scar. So scar prevention and scar reversal seem to be quite possible, which is also quite exciting. Skin rejuvenation, we were the first one to actually investigate it rather than just applying and having a few before-after pictures. So we established a 100-person clinical trial where patients or customers were treated with microneedling plus exosomes with the goal of skin rejuvenation. And then we assessed the improvement. Of course, I have to say that this improvement was fairly subjective, but it was unbiased. So our patients or study participants had answered those questions, whether they see an improvement or not, blinded on an online questionnaire, and they were free to say if they really noticed something or not. So you will appreciate that this is a remarkable result. On average, about 90% across the board of things that you want to see improved. Interestingly, in this study, it also became apparent that the younger
Apple
patients seem to benefit more significantly or
and the
faster
matter.
from the treatments compared to older patients. But it again makes
Arca
sense.
laser card. Naman
Dr.
Naman
Smoothie, can you
tayo
please
minsan na.
can you please
Ipabuo ng bolatan na. Kamu
mute
kemasa naman
yourself?
nila.
Now I lost my train of thoughts. So there was a remarkable improvement
Yeah, I think,
across the
Mike, you were saying, yeah, that there was a remarkable response, right, across the board from pigmentation, firmness, wrinkles, redness, texture, radiance.
Yeah.
But at the end of the day, what a lot of patients wrote, there was an open comment section that patients could write into
Yes.
where they were not prompted to give a response. And so many women in their 30s, 40s, 50s, and 60s said, I love my skin so much after treatment. For the first time in my life, I'm going to the store without makeup on. My skin itself is so much more youthful. It's moisturized. It's smooth, and I don't even feel the need to cover it. It looks fantastic, and that was something that was unexpected. But we're also very proud of that, because a lot of these women had never had that experience where they actually felt confident in their own skin.
Mm-hmm. That's true. Thank you for adding that, Aaron. Now I remember what I was trying to talk about. There was this incident that we saw by tendency that younger patients in their 30s seem to benefit more or faster from the treatments compared to patients that were a little bit older in their 60s. But thinking about it, it again makes sense because if you assume that you shave off like 2-3 years of biological age with every treatment, and you undergo 3 treatments as a 30-year-old and go back to a 20-year-old skin, that is a dramatic effect that you can more easily see when you compare that to a person in their 60s or even 70s, and they undergo also 3 treatments, and they might also shave off like these 6 to 10 years of biological age, but then you're still in your 60s. So it takes a little bit more, and it's something that we are still trying to evaluate and to establish some benchmarks. It has also been shown, or we have seen, that numbers kind of matter. So if you apply more exosomes, you seem to have a more improvement, but it doesn't correspond mathematically. So if you take 5 billion exosomes versus 50 billion, the 50 billion might render a better improvement or higher improvement, but it's not like tenfold. So what we came to recommend is increase the frequency of treatments and do them more often, rather than increasing the number of exosomes in just one application or treatment. This is another field of application for exosomes, wound healing. In this particular case, it's a burn. There was a young boy who actually had an unfortunate encounter with boiling hot water that poured down his shoulders. Fortunately, there were exosomes at hand, immediately put on, and that prevented the worst of it. What you cannot see in those pictures, it's a timeline of every day after the treatments. What you cannot appreciate here is that there was no picture taken, obviously, as soon as it happened, when the whole back of this boy was actually red. Upon applying those exosomes, that redness was addressed and went away pretty fast. Only the most severe burn, which was a second-degree burn here on his shoulder, remained to be treated, and over time. And here the gray picture, you see that area after 6 weeks, and you can hardly notice any scarring anymore. So that is a remarkable improvement and ability to heal. Then there, of course, is the question of adjunct therapies. So there's various modalities that you can combine with exosomes and that actually increase the efficacy of exosomes. There is things like microneedling, of course. You create those microchannels, and that enables the exosomes to penetrate deeper into the dermis, epidermis. And you have things like CO2 laser applications or RF lasers. And so there are various modalities that are all interesting. When you think about microneedling by itself, it was found to actually do something. And the way that works is that by damaging the skin, you force it to regenerate and repair. So you have a secondary effect by triggering repair and regeneration of the skin, but you, of course, limit it to your body's ability to actually repair and that kind of damage. So if you provide exosomes, it will be boosted, obviously, and the micro damage and micro inflammation triggered by microneedling or laser applications will trigger or activate the exosomes, and they fuse with damaged skin cells, etc. And while fusing, they again are able to reprogram the cell, and the cells can regain full functionality. There's also to be said, as I mentioned earlier, you provide, by providing or applying exosomes, you provide all the building blocks and instructions for the cells to reprogram. Any of those modalities by themselves cannot do that. So they just like do some damage and trigger some repair. And that is great, but it's not doing as much as the exosomes are solely capable of doing. So they can actually fix those cells completely by providing all those building blocks and instructions in shape or form of the RNAs and functional proteins, etc. All their cargo contributes to that effect. Here's already a bit of a summary. It's in the end of the day, all about clinical evidence. And you will find that a lot of claims are being made by a lot of vendors, and you might have the occasional before and after picture, but sometimes even those are either not very compelling, or you have to wonder how much Photoshop has been done. So clinical evidence is imperative to actually assess the feasibility as well as the safety for applications in dermatology. And we have shown that both for skin rejuvenation and hair growth, as well as for scar reduction and prevention and wound healing. So across the board, both aesthetics or cosmetics, as well as medical applications, have been found to be applicable or amenable and can benefit from exosome treatments. The modalities by which you increase or boost the exosome treatments is something that can still be, discussed or figured out. There's obviously some practices that have, preferences in how they address certain things. So there's not one modality that fits all, but the combination of such modalities with exosomes will definitely be very beneficial to your patients. As to the future of regenerative aesthetics, exosomes will definitely revolutionize both skincare and dermatology. They already do. Right now, it's a very interesting time in this field because, especially in the field of aesthetics and cosmetics, there's a lot of snake oil out there. There's a lot of vendors that provide products that, let's say, they are suboptimal at best. And it requires a little bit of education to tell people about exosomes, what their potential is, but also what you have to watch out for in order to get a functional and bioactive exosome that can actually do all those things that I talked about, and not some exosomal product that is rather questionable in terms of their sources, where they come from, how they have been manufactured, and what they can really do. So I would encourage you to always ask tough questions and figure out how much clinical evidence a vendor really can provide and what other information they can provide to substantiate any claims they might make. With exosomes, there's something like personalized regenerative medicine on the horizon without the need to actually rely on the patient's own biological sources. So my claim to fame, for instance, has been stem cell therapy for patients suffering from heart failure. And that was 25 years ago, where we established the patient's own bone marrow as the best source for stem cells to actually help them. And it was very effective, but as you can imagine, those patients are typically on the older side, have comorbidities, are otherwise impaired in terms of their health. So the quality of their biologics is just not ideal. Today, unfortunately, we actually have the means for allogeneic transplants, off-the-shelf solution for stem cell therapy, as well as exosomes derived from those mesenchymal stem cells, that while they come from a different source, a different human, these stem cells have just finished building a new and healthy baby, and the exosomes derived from them have the utmost potential and potency that you find anywhere. So it is not only skincare and aesthetics. It goes well beyond that. I consider it the next generation regenerative tool for a wide variety of applications and treating diseases, even beyond dermatology. By age zero, I hope I made a point of conveying how important it is to opt for the best sources. The optimal source for exosomes for any kind of regeneration or rejuvenation is definitely within perinatal tissues. And among perinatal tissues, Warren's jelly has been shown to be the very best source for various reasons that I'd be happy to give you more information about on a different day, or you can always contact me, and I'd be happy to send you a number of white papers. We have proven results that are also trusted by experts. So we go beyond making just claims, and as I said, ask tough questions. If you have any questions or doubts about the efficacy of our exosomes, or also in general, if you want to know more about exosomes and how they work and why they work and where they should be sourced, always feel free to reach out. One of our missions as a company is education in the field, because we believe in what we are doing, and this education will drive the field forwards, and will enable all of us to help countless patients that are suffering from various conditions or diseases. And yeah, including exosomes into your practice will definitely elevate your services towards the future of skin and health regeneration. That is all I have for today, and I appreciate your attention and interest in that topic. I'd be happy to take some questions, and fortunately for us, we also have Erin Crowley on here today. She is our CEO, and she is an unbelievable woman who has the knowledge, in-depth knowledge of everything related to quality and regulatory compliance, which is really important when it comes to the manufacturing of exosomes and shouldn't not be taken lightly. We might even have Julie on here today, I hope, when it comes to questions with regard to modalities that can be used in combination with exosomes. She is one source of knowledge that you won't find anywhere again. So together with the two ladies by my side, I'm happy to entertain any question you might have.
Doctor, there is two questions in the chat. Dr. Samruti, what about the genetic material transmission through exosome?
Very good question. So what you find in exosomes are RNAs. So unlike what you see oftentimes in published even or online, they do not contain DNAs. So that's a very important aspect, because some people have some concerns about exosomes potentially causing or promoting cancers. So they do not have any DNA. They are acellular, so they are not cells. They are not living entities, and therefore they are unable to cause any such threat as it is. We also often get the question of vaccine residues. Again, that's one reason why we actually opt for Wharton's jelly. Wharton's jelly is known to be fairly 100% protected from any maternal contaminations. That includes maternal DNA as well as vaccine residues. You can imagine that there's no adult in the US these days who hasn't been vaccinated at one point or another. And even for COVID vaccines, I think there's by now a 90% penetration. So you can assume that any mother donating her cord, umbilical cord, will have had some vaccines, but you will not find any of those vaccine residues in the Wharton's jelly or in the MSCs derived from them. So that makes it not only the most potent, but also the safest source for MSCs and exosomes derived from them. And any genetic material is comprised of RNAs, and they are what I called instructions, the blueprints that enables the cell to reboot and reprogram itself, so to regain full functionality again.
Okay, there is another question. Can you please explain about hypertrophic scars and exosomes?
We have not had a whole range of different kinds of scars that we treated. We know that it actually works. Hypertrophic scars should also be amenable to treatment by exosomes. As we have shown, there is some significant prevention of scars, as well as the ability to reverse scars, which is kind of interesting because it was always dogmatically proposed that you cannot remedy scar tissue. We found that not to be correct, and you can both prevent and reverse scar tissue by the application of exosomes. Oh, by the way, I forgot to mention our own Dr. Carla Mazeo. She is a capacity in the field of exosomes. She studied exosomes like well over 20 years ago and has a PhD in exosome biology specifically. And she's also a wealth of knowledge of all things science with regard to exosomes. So if you have any question in this regard, please feel free to ask.
Yeah, and Dr. Hardik, can you please take my question, Haitham? Dr. Hickey, you have any questions in your chat?
No, the last one was actually let me see. Genetic material, hypertrophic scars. Oh, there was a question with regard to microneedling. Do you prefer gliding or stamping? I'm not sure. Is Julie online? Julie, are you there? Doesn't
I think,
seem...
Mike, when it comes to hey, Mike, this is Erin
Yeah.
Crowley. I think when it comes to microneedling, gliding, or stamping, our exosomes are in saline. So from a gliding perspective, they don't glide per se like a typical glide. So we typically apply it afterwards. So if you were to stamp it, you can definitely use, there's a lot of stampers that have a cap for the solution to go into and it can stamp in. So it definitely works well stamping. In the field of dermatology, we're working with research partners all around the world. And if there's people today on the call who want to participate in Resiliel or Regenerel, our parent company, when it comes to studies, we are the world's largest producer of exosomes. Every umbilical cord we produce roughly has about 1,000 trillion exosomes in it. So our lot sizes are very large, and therefore it's great for study control. We don't have to change our lots in any way. But we're doing wound care studies, burns, post-surgery, cellulite, deep wounds, Mohs surgery, ulcers. So, if you have a clinic that's definitely specializes in particular areas in the field of dermatology, and you're not having results with your current technology, or you feel like those results are too slow, reach out to us, because we're always looking to do studies. And what doctors are finding is that exosomes seem to accelerate, a lot of the traditional dermatology procedures in terms of advancements of wound healing. And then when it comes to devices, we believe in exosomes for everything. There's very few applications where exosomes don't have an opportunity to be applied or paired with. But, we're finding that if you can incorporate exosomes into your practice with mostly all of your devices, or as a take-home product to help support your patients in their healing process, we're seeing phenomenal results on our clinical studies and our trials that we're doing, and we would love to continue to expand into this, both regenerative medicine and aesthetics. And we offer large sponsorship opportunities for people who are really looking to do studies. So if there's studies that we haven't touched upon yet that you would really be very interested in leading with us, please reach out. We're looking to move this science forward with the best in class exosomes, which are age 0 exosomes by Resilia.
Thank you, Aaron. I do have a
Doctor,
question here. Chat.
yeah.
Does exosome therapy have an effect on people with alopecia, especially those who have lost their hair follicles completely? So that is actually a tough question, and therefore I have to answer it with caution. So yes, we have seen it to be effective on people with alopecia. But there's also different causes for alopecia. It can be genetic, it can be temporary stress, and that is something we actually currently entertain as a real clinical trial, including IRB, under an IRB, to actually investigate exactly that question. So I would say yes, with a little bit of a but. It might not actually work for every person, depending on the cause and severity of the alopecia. So in general, we have seen good indications for it. Then there was a question about autoimmune disease. Again, it depends on what it is. We actually have a couple of cases where we utilize exosomes for the treatment of pandas, and it seems to be working. But we have to establish, dosages and best route of application. So these are always moving targets, and it's work in progress. But generally speaking, yes, autoimmune diseases are quite possibly helped by the application of exosomes. We have a question about melasma. But again, we have case studies where we have seen an improvement. And it's also one of those things that are further studied to assess in more detail how this best is addressed, what modalities we might combine with the exosome treatments, etc. And as always, there was also a question about dosage. Dosage is a tricky one. I mentioned that before. So for instance, a phase application, microneedling plus exosomes, we have tested 5 billion and compared it versus 50 billion and 100 billion to see if a dramatic increase of numbers of exosomes would show a better improvement. And what we found is that by tendency, it seems to be the case. However, it's not relative to each other. So that's what I mentioned. 50 billion is not 10 times as good as 5 billion. For some time, we actually promoted 10 billion as the sweet spot. But for all we know is that 5 billion exosomes apply on the face seems to saturate the skin at any given application. And we therefore recommend to repeat the treatment rather than increasing the number in one treatment. Dosage is still, it depends on the indication, the route of application, and what you address. Interestingly, for hair treatments, hair restoration, or hair rejuvenation, it seems that we want to use a higher number of exosomes at any given treatment. And then, of course, it's also a function of the surface area to be treated. I don't think I have any additional questions on my chat for now.
There is a question from
Oh
Taron
yeah, there's
Rata. Yeah. How this help in pigmentations and anti-aging? Hope this also helps in skin appearance. Yeah. The effect of exosome on skin.
I'm not sure if I understood that question very well. Can you read it again?
How this help in pigmentation and anti-aging? How the
Yeah.
exosome is supporting pigmentation and anti-aging and the skin glowing?
I see. So what exosomes do, they fuse with skin cells and are able to reprogram them so they can return a cell to a more youthful state. So if you talk about pigmentation, pigmentation arises from a malfunctional melanin production in cells, and if you enable the cell to regain full functionality again, you can fix that problem. That's why exosomes are so interesting. They really fix a problem and they're not just a palliative and superficial temporary remedy. That's why it's also so important to source your exosomes correctly. So for instance, never use lyophilized exosomes, because it is known that in the process of freeze drying, you actually destroy the exosomes. So they cannot function anymore as they usually would, fusing with a target cell, introducing all their cargo. So at best, you have some residual growth factors floating around that do some temporary good, but they cannot fix and regenerate the cell.
Okay, thanks. There
Can
is
go
another
further.
question.
Yeah.
Would one vial for face be enough? This is the question. No case, nothing. Yeah. Using one vial for face. Would be it enough or not? Depend on what? I don't know.
I have a similar question here. Would 1 billion for face be enough? Um, we would recommend like 5 billion for a face application. Again, if you use more, you might have a slightly better effect, but it's not really necessary. If you use less than 5 billion, you should have some effect too. Yeah, but then it goes a little bit in the other direction. So if you ask me for my recommendation, if you do a microneedling, for instance, or any other modality, and you want to apply exosomes after, 5 billion seems to be the sweet spot for the face. If you do more, it's by tendency a little bit better. If you use less, it might be less efficacious.
And this is
Yes,
Erin
because
Crowley again, just CEO of Resilio. So, and then if you also want to talk about hair, that's a different question. So we're in clinical studies with hair with microneedling. I know Mike talked about this earlier with alopecia, but we know that dosing is significant with hair. Some people have a great result with 5 or 10 billion, they're younger, but we know with older patients or patients of health conditions, dosing is higher. So that's why it's so important to do dose studies. And that's why we launched Resilio with that 100-person clinical study. We didn't sell any product in the US until that 100-person clinical study was done. We wanted to ensure that science was leading the way, and doing that dosing study is important. And so that's why with hair, completing the dosing study, we have hundreds of case studies with hair. So we have a general idea that you need more exosomes when they're older, more frequency, more damage, but we don't know what that is. And when that study is completed, we will absolutely be publishing that.
I have another question
And a
here.
big,
Whether there are
yeah, and sorry, and a big
variations.
component of that is we also very much believe in exosomes being affordable for patients. So, we don't want to overdose, not that you can overdose, but give them more exosomes that are needed, because exosomes are costly. And so we really want to provide really data-driven science for patients, but we also know that the application for hair is different. So in a lot of countries, they can inject directly in and we see results. And those results differ based on modalities. So we're in the process of doing a hair study that's just exosomes and saline, like Dr. Heka mentioned, because we know exosomes are small enough that they should absolutely be going through into that hair follicle. And, you know, it's quite possible in the near future, maybe a device isn't as needed as we think. Maybe it's just frequency of topical exosomes on a daily basis.
Yeah, I agree.
Yes, yes, but please, Dr. Heke, regarding this question, would 1 billion for face be enough? I think it's something commercial, yeah, depend on the financial capability of the clinic and the distributor. Because if I'm here in UAE, I'm selling the 5 billion, okay, and I'm telling them use 2.5 ml per session, far away the case or the indication. If I'm going to sell the 10 billion, should I, because of the price, should I tell them to use 1.25 ml, or I also should tell them to use the same dose of the 5 billion, 2.5, half of the vial, if I'm selling 5 billion and 10 billion? I think this is a question for us, yeah, and for Great Lock maybe.
Yeah.
Because this question depends on the concentration of the billions inside the vial. We have two vials, one 5 ml and one 5 ml. One have 5 billion and one have 10 billion.
Dr. Hika,
Depend
I
on
think again, you would typically, so from our manufacturing perspective too, frequency is important. So if you're pairing these exosomes with microneedling, frequency is important. So if the patient can't pay for even a 2.5 billion or a 5 billion exosome, microneedling might be eating the cost of a lot of that service. We would rather have you do a low dose, like a 1 or 2.5 billion, more frequently than just a one-time higher dose. Correct, Mike? We really want, frequency is also important. So if you need to do a lower dose, more frequent, that's okay. Just include the exosomes. Even 1 billion exosomes are going to help in that healing process of that inflammation. You know, they'll definitely be captured. And so, you know, I think at the end of the day, if you're using an oxygen mister or infuser, you can use about 1.25 ml solution will cover a full face. If you're using a syringe dropper, 2.5 ml will cover the full face. We're, from a company's perspective, we're applying this product more and more with an oxygen infused mister because you get more coverage and you don't have to use as much. So especially for the cost conscientious patient and doctor, the product goes further if you use an oxygen mister infuser onto the face rather than just dropping it on. So we would definitely say, if you need to go, you know, lower doses, absolutely you're going to have wound healing effect. We don't have a clinical study on 2.5 billion. We have a clinical study on 5 billion, but frequency is important. So if you need to split that bottle more, and 2.5 billion is great. If you want it to go even further, you can use that oxygen mister. It will spray a mister finer. You can probably spray 1.25 mLs. You can spray probably 3 passes over the person's face and they're really feeling it. So you can apply it right away. So when you do that microneedling on the face, like the cheek, you can spritz. Then you move into the, you know, if you're in the forehead, immediately spritz. Like, and then when the full face is covered, spritz. So you can really be using the exosomes more with that oxygen mister infuser than you could with the syringe dropper. So we're really recommending that more and more now.
Yeah, sure, I got the point. Okay. There is another question.
Various ways to go about it. There's another question here that relates a little bit. Are there 2 variations of exosomes, one for hair and one for skin, or is it both the same? So it is the same. It's the same exosome. And if you have vendors that actually claim that one exosome is specific for skin and the other one specific for hair and specific for scar, I don't know. That's just marketing. That's nonsense. What you want to have is a potent and bioactive exosome. And that can basically do it all, just as I mentioned earlier, when you source them correctly, when they are H0 designated and derived from Wharton-Shelley MSCs, then they have the potency to really fix and repair any given cell that is relevant to any given indication that you're interested in. So these exosomes don't distinguish. They're just used up and taken up by cells that actually need both the building blocks and the information to reboot. What does differ sometimes is the concentration. So it was mentioned that you might have a product where you have 10 billion in 5 milliliters versus 5 billion in 5 milliliters. So these are different concentrations, and it relates to the number of exosomes you want to apply in any given application. But also the volume is important. So originally we actually sold 5 billion in 5 milliliters here in the US. And then we were advised by our customers that it is too much volume for just the face. It was just too much liquid. And therefore we actually cut it down to 2.5, which doubled the concentration. But in the end of the day, it's basically the number of exosomes you want to apply in any given go. So that being said, if you want to apply a higher number of exosomes for hair restoration or hair rejuvenation, then you would opt for a higher concentration of exosomes. But the exosomes contained in your respective vials are the same, at least from our company. So we also don't add anything to it. We strictly adhere to purity protocol. So it's really just H0 exosomes in saline, and that's it. There's no addition either needed nor advised. Like some vendors mix in peptides and amino acids and vitamins and God knows what else. It is completely unnecessary if you have a bioactive and functional exosome with a required potency. It can do it all. How are pre-mixed exo and powder exosomes different? I'm not 100% sure if I understand that question completely, but powder exosomes, there's no such thing. Exosomes, they are not cells, so they are not living entities, but if you make them into a powder, that requires freeze drying. So if you take the water out of your exosome, the exosome bubble bursts. So they have a bilipid outer layer, and when you freeze dry them, you destroy that outer layer. Therefore, the exosome can no longer fuse with the cell membrane, and therefore it can no longer function as it should. So it cannot fix the cell, it cannot repair it at its core, and it cannot help the cell to regenerate. All you have left then is a palliative, very superficial and very temporary effect by the sheer virtue of some exosomal debris that might still be contained in it. So that's the major difference. If you have a powder exosome, it just cannot work. And if somebody is telling you otherwise, it's just incorrect.
Hey, Mike, I just want to jump in on that. For everyone
Mhm.
listening today, go on LinkedIn and please join the Exact Oversight Bureau. Exact stands for Exosomes, Auditing, Compliance, and Testing. Dr. Carla Mazzio, who Dr. Haka mentioned earlier, is chairing that committee. And there's about 10 exosome global products that have already been sent to Boston University and to Harvard, and have tested all of these products to see if they have exosomes in it. Do they have a nanosite NS300 that shows particle size meets exosome or not? And have they had a transmission electron microscope? And is that bilipid layer that Dr. Haka is speaking about, is it intact or not? So at this point, there's about 10 companies. You would know them all very well. 2 of them are the largest companies in the world. And their bilipid layers are broken and their exosomes are not functional. They're not bioactive. And your patients are only seeing a result of the dilutant properties they put in. They're not seeing a result of an exosome. So it's really important that people participate in the Exact Oversight Bureau, as that bureau is starting to write the manufacturing quality and safety guidelines for the entire industry of exosomes. They're also auditing companies and doing testing so doctors and patients can feel confident in the products and exosomes that they use and know, are they bioactive and functional, or are they null and void? So please stay tuned, as these publications are coming out on a regular basis with the Exact Oversight Bureau. And that bureau is a consumer protection bureau here to help doctors and patients make guided decisions on what products to use, because this industry is full of misleading garbage and it's a lot of fraud out there, because a lot of these companies are not coming from regenerative medicine. They're coming from cosmetics, and they're not familiar with exosomes or how to manufacture them properly. So it's imperative that industry steps up, because FDA is not going to, and the industry steps up as a whole and says, these are the guidelines for testing, auditing exosomes, and characterizing them. And that's exactly what the Exact Oversight Bureau is doing. And Dr. Carla Mazzeo is leading that effort right now in the blind testing being done at Harvard and Boston University. So please stay tuned. There's publications coming out on a very frequent basis there.
Thank you, Erin. Yeah, it's very important, that work, because it will establish certain standards that are so far missing or are not being observed by almost all of the vendors that are out there. And by establishing those standards, it will enable you to actually ask those tough questions and make sure that there are certain standards observed, both with regard to quality as well as safety. I think it's imperative, even for aesthetics applications, because if you do a microneedling, you have a big open wound, and what you want to apply there should be as safe as a medical grade product. That is something that we guarantee, because we do not distinguish between medical application and aesthetics application with regard to our manufacturing standards. And that's why we argue that those are the best in class, both in terms of potency as well as in terms of quality and safety. And this is a standard by which we want to be measured, and those are the standards that we propose for the whole industry to be measured by, for all your safety and for getting what you pay for. Well, I don't have any additional questions here on my chat.
Me too. But Dr. Hardik is asking for the LinkedIn link to join our
Exactly.
LinkedIn batch. Yeah.
Give me a second.
Mm.
Aaron, do you happen to have the, or Carla, does one of you have the link
I just
for
wrote
the?
the name. I don't think there's, yeah, I'm not sure about the link because it's a group, but I did write the name in the chat. So Exact, if you type into groups in LinkedIn and you go to Exact, 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 like it's exactly an exosome, Exact Oversight Bureau. It's a group in LinkedIn, and the website's currently under development. And we can, hopefully send out a link if we get this after to the group participant.
Yeah, we follow up with it to provide a link that's more easily found. Okay.
Thank you, Dr. Higa, so much. It's always extremely informative.
My pleasure, as always.
Thank you, Dr. Michael. Thank you, Engineer Aaron. Thank you, Dr. Carla. Thank you for everyone joining us every time, and see you soon, inshallah.
Yeah, thank you to the Great Look team for organizing this. We appreciate it.
And just
You're
also
welcome.
thank you, Sarah, for sending the link to the oversight bureau. You find it, all find it in the chat thread.
Yes, Dr. Hardik can take it. Okay. Yes, he got it. Okay. Thank you, Dr. Michael.
Wonderful. Thank you. Thanks for
Thank you.
organizing, and looking forward to the next webinar.
Inshallah, soon, inshallah. Okay. Bye-bye.
Have a great day, everybody.